You are still on to the conversation on Lagos television. Before that break, I did say that we'll be shifting gears and, of course, focusing our attention now on health, especially the outbreak of diseases and prevention. And you will recall that the NCDC rather raised an alarm over Ebola, cholera, yellow fever, and some other diseases recently. This morning on the program, we have a medical doctor with us in the studio, and together we'll be looking at the outbreak of diseases and prevention. It is my pleasure to welcome to the conversation Dr. Oladipo Kolawole, Associate Professor of Molecular Virology. It's a pleasure to have you.
Yeah, thank you.
Okay, I think the first question to ask you this morning will be that many of us are curious as to why we have a rise in the number of diseases that we have around us, especially the new strain. Okay,
let me just put it as a disclaimer first that I'm not a medical doctor.
Oh,
yeah, but a great biomedical scientist,
okay.
And my area of specialization is infectious disease, molecular virology and genomics. So actually, for now, the diseases that you made mention of, these are prominent diseases we have in Nigeria. Talk about Lassa, talk about cholera, yellow fever, even measles some of the time. But if you look at the trend, Lassa is not new to us. So it's something that we have understanding about climate. So there are specific time of the year that it emerges. Even cholera too, it has to do with sanitation, poverty. So there are specific time of
especially during the rainy season.
Rainy season, because if you look at many of the houses do not have toilets, every other thing. So all those things are speculated during the dry season. So once the rainy season comes in, it washes most of those things through water that we are meant for drinking when we don't have enough potable water for the population. So you can see that. So all those things have factors that are responsible for it. And the major thing we need to do for us to have understanding of it is that what are the measures that we are putting in place to counter the factors that are responsible for such occurrence, outbreak every time.
Okay, before we talk about the measures now, with this new development, how worried should we be as individual and government at different levels?
Well, to me, I don't see any cause for alarm in all these things. Because
even in our rural areas?
Yeah. The reason is that there are a lot of measures in place.
Are they effective?
Yeah. What can I say? Some are effective, some are not. Because, I do tell students, if you score 70, you score A. If you score 80, you score A. If you score 90, you score A. But what we have now, we look at where are we coming from and where are we now. Not just judging about where are we now.
Okay, so where are we coming from, where are we, and where should we be?
Perfect. Now, where we are coming from is that we have more. If you look at data, statistics, if you go to NCDC, look at their website, we have data, because we speak to data. You can see that the data we have now is more lesser than what we have in previous years because of measure. But that measure is not enough. We need to put in more funds, more strategies, so that we can have a better result. That because you look at the population too.
It's growing.
It's growing. So the measure that we're using some years back may not be applicable now. And we have to ensure that our health system at all levels, primary, secondary, and tertiary, are well funded for every emergence of any pathogen that we might be talking about. And if you look at vaccination issue now, that's another case, because most of the vaccines that we use, not only in Nigeria and Africa, are donations. So once you don't receive the donation, you can see that till now, Nigeria has not been able to get malaria vaccine. It's not part of those who are. So it's not that we have an indigenous things that we are responsible for it. So until we get all those things right, the level at which we have, we may not be able to get to where we intend to be. So those are the things that we have to look into holistically. And it's not about a government issue again. It's everybody's issue. Because private sector have to come into place, government have to come into place, individual have to come into place. So no government of any country can holistically solve the health problem of the whole of the population. So all of us holistically have to come into place and make sure that we have it done.
So in terms of funding, I want us to look beyond the federal government now. Let's come to the subnational level, state and local governments. Are you impressed with the level of funding? That is one. And aside from the lack of vaccination, malaria, like you rightly cited, what are the other challenges that we are facing as a nation?
Now, one of the challenges we are facing as a nation at state and local government level, they are doing their best. Most of the time, the best that someone is doing may not be the best. Yeah, because somebody comes here and says that, oh, I'm doing my best. That is to his own capacity. But we know that the best is not the best. So the state and local government have to put in more funding to our primary healthcare system so that everybody will have access. They are doing it, but they have to do more than what they are actually doing. But when it comes to funding, health is very expensive. Health is very, very expensive.
Health is wealth.
And health is wealth. Very expensive. If you want a quality health, it's very, very expensive. So that is why partnership between private and public is very, very essential. Very, very essential. So that we can have a system in place. I was talking to someone that now we have more of, if you look at TED Fund, that company gives some part of their profit, a percentage to TED Fund for them to sponsor research. So we need a lot of private organizations that have to invest into the health system of Nigeria. And one other problem that we have seen, that we continue to be seeing, is shortage of staff. You know, this jackpot syndrome is a big problem.
Brain drain.
Yeah, it's a big problem. Even as the government says that they should increase quota for medicine, for nursing, we teach students, because I teach at Adeleke University in Hede. Now, if you discuss with the students, as they are graduating, they want to leave. So that is the big problem, because when we talk at some national platform, I do talk about that. I am not interested in capacity building anymore. I'm interested in capacity retention. What can we do to retain them? Because if we don't retain them, there is no system that we build. It's not sustainable. So the government, individual, needs to come into place so that people that we have, we can train them, we can retain them, and they can be used. And you cannot keep anybody, because we have a choice to decide where I want to live. So if we can do all this, it will be better. Then another thing is public engagement, enlightenment, sensitization in local dialect.
Especially because of those are the grassroots.
Those are the grassroots, in local dialect, not in English. Because most of the population that speak the local dialect are more than those who speak English. And if you can do that...
majority of them are not literate.
They are not literate. So you go to the bush. I've been to some villages and you discover that there's nothing here.
In terms of infrastructure?
Infrastructure, there is nothing here. There is nothing here. So we need to do more of public engagement, advocacy in local dialect. What I mean by local, it's not even like Yoruba, because in Yoruba now, the Yoruba that Ijebu is speaking
is different from the one we are speaking in Lagos.
In Lagos. It's different from the one speaking in Ibadan. So if we want to pass the message across to them, we have to come down to their level and use traditional rulers, leaders, even pastors, imams, because these are public figures that people really listen to. So that if we can sell the message across to them, I'm betting with you, we're going to have a great impact in the community based on this.
Okay, let's look at the alarm raised by the NCDC over cholera, yellow fever, malaria. As individuals now, what are some of those habits that we also do that is contributing to the disturbing trend of these diseases? Now,
one of the major things that I'll speak in addition to something, I want to speak about, the one that is common is antimicrobial resistance, because they talk about, that is antibiotics. People do self-medication so much. And all this thing is affecting us. Because for a drug to be potent, there is an expected minimum concentration of the active ingredient that we need to do. Now, if I take drug irrationally, by the time I need the drug for that kind of ailment,
It's not going to work.
it's not going to work because my system have been used to it. So, in some other countries, there are some drugs that you can't go to any pharmaceutical store and just buy, especially the antibiotics. Without prescription, you can't buy in UK. But in Nigeria, I can go to any shop there and tell them I want to buy ampicillin, I want to buy. So we have misuse of drugs. Then another one is underuse of drugs. The doctor gave a prescription and says that use
Take
it
2 in the morning, take 2 in the
in the
afternoon.
for the next 7 days. So I just took the drug for 3 days and I felt, oh, I'm okay, I'm good. I left the drug. So when I do that for a period of time, what we are teaching the pathogen is that we are training them to get used.
Those are the disease-causing organisms.
Disease-causing organism, to get used to that concentration. So that by the time they're going to change their structure, that they call it mutation. So next time that pathogen escapes into another person and they prescribe that kind of drug for the person, it will not work. So the public needs to know that if there are prescriptions given to you in the hospital, take the instruction given to you by your medical doctor and stop self-medication. Then most of these diseases are also vector-borne. So controlling of vector, like Lassa now, is rat, mystomy rat. So why will you go out and eat a food that you see that your rat has generated into
But
it?
how would you know?
Because you're going to see, that's why you have to cover your food in a container that is a rat cannot have access to. Not in sack. So either gari, rice, and those are in the villages. We tell them that I use this cassava flakes that they spread on the road. That is not good. Because you are not there, but any rat can come in, any insect can come in, put their urinate on it, feces on it. You just come in and pack everything, especially gari, and you will not need to go through hot water. You just pour it in your glass cup, pour cold water into it, and you heat it. So those are the things that we need. Now, when we take care of our environment.
I was going to say that because for malaria, your environment matters a lot.
Exactly. Cleanliness is next to godliness. So once our environment is clean, 50% of ailment is taken care of. 50% of infectious disease. Even for malaria now, we are having mutations for malaria. And some of the time, what people call malaria is not malaria. Because we have underdiagnostics. Because there are some other diseases that mimic the symptoms of malaria, that people think it is malaria without laboratory diagnostics. We have like dengue, we have like yellow fever, we have like West Nile, we have like chikungunya. These are viral pathogens that the presentation is malaria-like. And once me feel that, I just go to the pharmacy.
Or you self-medicate.
Yeah, then I'll not say, I'm using anti-malaria dogo for the past few days now. It's not going. So we have the case of underreporting of some ailment, misdiagnosing them as malaria. So, and that is one of the cases that we can talk about. For other cholera, it's just environment. It's water. When we have a good water system, I think we're able to take care of that.
Okay, so for this alarm raised by the NCDC, I am worried as to if we have the capacity to withstand the outbreak of another pandemic in this country.
Yeah, we have a system on ground that NCDC is coordinating, but if you look at the structure on ground compared to our population, in terms of data, the structure is not enough. We have a structure on ground, the NCDC is working on, they are doing their best, but if you look at the population, we don't have enough. Although they are trying their best to put in, because health, like I've said earlier on, is expensive. For them to put all those things in place is millions of naira, billions of naira. And not putting those things in place, we have some personnel that will manage those equipment, that will manage those facilities. The population of those personnel is lesser compared to our population. Because you see that they have a facility for genomic sequencing, that they sequence for them to know the particular strain that is circulating in the environment, and to know even if the strain has mutated, either to ensure that there will be new drug for such. Those are the things, NCDC, and we have some labs in Nigeria that can do that. They have sequence facility in Naima. NCDC is setting up another one in Yaba. In Ede, Professor Api is there. In Abuja, there we have some other labs. But those labs are not enough. We need more of those so that when there is pandemic or epidemic, we're able to respond immediately to it. And that's why I said we have few bioinformaticians that can analyze those data. We have them, but they are not as much as what we need.
So when there is pressure, we are likely to have crisis.
Of course.
In terms of manpower.
Because of manpower. And another funny thing is that we train people. Most of the people that we train, they have left. So, but we believe that everything we are doing now is a sensitization. And people are hearing, the government are hearing. So with these, they will know where to put resources into for us to have a better life for our population.
Prevention, like we always know, is always better than cure. So how strategic should we be in implementing some of our preventive measures?
Now, one of the things that is burning in my own heart in Nigeria is that we are over-reliance on foreign aid. We are over-reliance on foreign aid. We don't have capacity to produce vaccine in Nigeria, because that's one of the preventive measures. Because if people are well vaccinated, you are sure that when there is an outbreak, there will be an herd immunity in the community, and the spread will reduce. So we need to put more effort. I know the government, the federal government, has some initiative towards that. Beyond initiative, we have to see the materialization of those initiatives so that people can have access to vaccines. When it comes to diagnostics, most of our diagnostic tools are not in-country produced. They are not in-country produced. They are all imported into the country. So if there is any outbreak, we have to be dependent
on the importation of
importations.
Vaccines,
most of diagnostic tools. And now the problem of supply chains will come in. Because for you to import it, before it comes to your country, before you clear it, before you get to where they want to deploy it for use, these are things.
And the new tariff increase coming from President Donald Trump is not going to help matters as well.
Of course. So we need a way where we can locally be producing.
Look inward.
What we need for our health, so that we not be dependent. Nobody was hoping that we were not expecting Donald Trump will cut off the funding, the aid, the way it did. And if more in future happens, what happens to our health as a country? So we have to look inward and see how we can leverage on different professionals that we have in the country so that we can be self-reliant in future.
I'm actually not an advocate of self-medication, but even today, when you look at the cost of common medications, they are not cheap. And so some of these issues are equally pushing people to self-medicate as well, because the economic power is not there anymore.
Yeah, the economic power is not there. Yeah, but one thing I'm really sure about is that, you see, I said earlier that health is expensive. But if it is worth taking care of at the early stage, it will be better than waiting till when there are complications. Because our system, our body communicates with us every day.
Sometimes we don't listen.
We don't listen. So if we listen, it won't get to that stage. Because everywhere there is stress, You have to know how to cope with stress. You have to eat good food. Good food is not expensive food.
Sure.
So these are things that people should need to understand and know. And some of the time, they're very cheap. Fruits are there. You sleep when you ought to sleep. You see, things that you cannot achieve now, don't create problem for yourself. Everything is vanity. So you have to take it cool and take it calm. Then, you see, we have a lot of agencies too. They are looking at the potency of those drugs, either they are fake or not. So even everybody that is working in that space, you ensure that these are family members. So anything I'm importing to the country, let it be of good quality, not just profit.
For profit making.
Yeah, but for betterment of life. So if all of us can come to that realization, life will be much better for each one of us in terms of health.
Okay, before we come to that realization, for those that are battling with maybe malaria, those are the common ones.
Yeah.
Malaria, yellow fever, which other one now?
Lassa.
And there's this other one, I'm trying to remember the name now. What are the symptoms that they're likely to see that will serve as a trigger for them to go and seek medical help?
Now, as regards symptoms, it's very complex. What I mean is very complex is that most of the time, most of these ailments make the same clinical presentations. That may make the same clinical presentation. So the best thing we used to tell people is that before you start medication, get yourself tested. Take your sample to accredited laboratory, diagnostic laboratory, let them test you. So once you are being tested, you're able to be sure that, oh, this person is suffering from malaria, or this one is Lassa. Because all of them can come up with headache,
symptoms.
Yeah, but fever,
temperature.
That is high body temperature, and some of the time nausea, some of the time. So you can see that until a proper diagnostics is made. That's why I cited an example the other time that somebody may be suffering from dengue or suffering from chikungunya and assume that he's suffering from malaria, and just go to the counter and give me artemisinin, acetonate that I want to use for the. Whereas what is suffering from is not a parasitic infection, it's a viral infection. But the clinical sign and symptom mimic each other. So we need to enhance our laboratories for accurate diagnostics, and which I believe that the Nigerian Medical Laboratory Council of Nigeria, they are up to the task, because that's why they ensure a proper certification of all laboratory diagnostics that we have in the country. So we should leverage on the system that we have and encourage it.
Okay, what an interesting way to anchor this conversation this morning with Dr. Oladipo Kolawole on outbreak of diseases and prevention. And there was a particular statement that he kept making that we should not self-medicate anytime we are not feeling fine. There are medical professionals, even though they are not enough, do not self-medicate at home in your own interest. We thank you very much for this conversation.
Thank you so much. Yeah.
All right, we'll take a very quick break. When we come back, it will be time of joy to take you through our conversation on the program this morning. Do stay with us.